Day Visiting Lecturer. First and foremost, let us extend our heartfelt welcome to the Dean of the Faculty of Public Health, Universitas Diponegoro, Dr. Budiono, Bachelor of Public Health, Master of Health, the Head of the Department of Biostatistik and Demography, Farid Agus Hibana, Bachelor of Public Health, DEA, PhD, respected lecturers, students, and all participants, and of course, our wonderful guest speaker from Thailand, Dr. Sutthida Chuanwan. Ladies and gentlemen, welcome to webinar session on Elderly and Health. Before we begin, it is my privilege to invite the Dean of the Faculty of Public Health, Universitas Diponegoro, Dr. Budiono, Bachelor of Public Health, Master of Health, to deliver welcoming remark. Dr. Budiono, the screen is yours.
Thank you, Mbak Imaniar. Thank you very much for this opportunity. Bismillahirrahmanirrahim. Dear Associate Professor Dr. Sutthida Chuanwan from Institute for Population and Social Research, Mahidol University, Thailand. Thank you for joining this lecturing, Prof. Sutthida, and warm greeting for you. And Farid Agus Hibana, PhD as a Head of Biostatistik and Demography, Faculty of Public Health, Universitas Diponegoro. Moderator, Mbak Imaniar Sevtiyani, SMMBM, MKM, and also our colleagues, lecturers, and all of the participants from undergraduate, master, and also doctoral students, and may all of the practitioners who join this lecture. Assalamualaikum warahmatullahi wabarakatuh. And thank you very much. The topic of this visiting professor is elderly and health. According to the WHO, by 2050, 80% of older people will live in low and middle income countries. And Indonesia, including these countries. The pace of population aging is much faster than in the past. In 2020, the number of people aged 60 years and older was greater than the number of children younger than 5 years. And between 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. And the number of persons aged more than 80 years is expected to triple between 2020 and 2050, reaching 426 million. While in the number of elderly people in Indonesia in 2023 will reach up approximately 32 million people, or 11.75% of the total population, based on data from the Central Statistic Agency of Indonesia, or BPS. This percentage continues to increase and is expected approximately 20% by 2025 and 45. Common condition in older age include hearing loss, maybe also cataract and back and neck pain, osteoarthritis, chronic obstructive pulmonary disease or COPD, diabetes, depression, and also dementia. As people age, they are more likely to experience multiple conditions simultaneously. Older age is also characterized by the emergence of several complex health states, commonly called geriatric syndromes. They are often the consequence of multiple underlying factors, including frailty, urinary incontinence, falls, delirium, and pressure ulcers. So, what actually effort can be made to promote health among the elderly? Do elderly people need to consume certain food, for example, vegetable or fruit, or consume calcium-rich food, or increase fiber intake and limit sodium food, and also stay physically active? So they have to exercise routinely, maybe, and also to limit the sugar and salt and fat consume, of course. In addition, do other effort need success, regular physical activity, stress management, and social support? I think it's also play important role in preventing chronic disease such as diabetes, heart disease, and dementia. So, social factors such as housing and income, I think also affect the welfare of the elderly. So, Associate Professor Dr. Sutthida Chuanwan from Institute for Population and Social Research, Mahidol University, Thailand. She is an expert with excellent knowledge and experience in the field of elderly and health, of course. I think she has so many research and experience related to this topic. She will briefly explain this in detail. I hope you all pay attention to and are active in discussing this topic on this lecture, because it will lead you to a different perspective. And finally, enjoy the lectures, and with your permission and Allah Subhanahu wa Ta'ala, this lecture I officially open. Bismillahirrahmanirrahim. And thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Budiono, for the warm welcome and inspiring remarks. Ladies and gentlemen, today's lecture is organized by the Department of Biostatistik and Demography, Faculty of Public Health, Universitas Diponegoro. The theme that we bring forward is Eldery and Health, a topic of a great importance given the growing proportion of elderly population worldwide. As we all know, the aging process brings about unique health challenges, from chronic disease management, mental health, to social support system. Understanding this issue is crucial not only for academic knowledge but also for developing evidence-based policy and community intervention. Through today's session, we hope to broaden our perspective, enrich our understanding, and gain insight that can help us respond more effectively to the health needs of elderly population. For that reason, we are truly fortunate to have with us an outstanding speaker who has dedicated her expertise and scholarship to this very field. Now, it's my privilege to introduce our visiting lecturer for today, Associate Professor Sutthida Chuanwan PhD from Institute for Population and Social Research, Mahidol University, Thailand. Before we begin, let me share a brief introduction of our distinguished speaker. Okay, Dr. Sutthida Chuanwan is currently serving as an assistant professor at Mahidol University. Her academic and research interests her academic and research interests are primarily focused on issue of aging, centenarians, and demographic projection areas in which she has made significant contribution. And then, Dr. Sutthida Chuanwan complete her bachelor degree in psychology and guidance from Silpakorn University, Thailand. She then pursued a Master of Art in Population and Social Research at Mahidol University and later obtained her PhD in Demography from the Institute for Population and Social Research, Mahidol University. During her doctoral studies, she also spent time as a short-term scholar at the University of Washington, Seattle, United States, supported by the Royal Golden Jubilee Scholarship. Over the years, Dr. Sutthida Chuanwan has published numerous research articles in national and international journals, particularly on topics related to population aging, centenarians, and demographic transition in Thailand and Asia. She also teaches graduate level course in substantive demography, of Thailand's population structure. Her work has been widely supported by organizations such as at Thai Gerontology Research and Development Institute, the Thailand Research Fund, and the Thai Health Promotion Foundation. Through her expertise, Dr. Sutthida Chuanwan has contributed greatly to our understanding of demographic change and the health and well-being of older population, not only in Thailand but also with implication for other ASEAN societies. Okay, thank you. So, without further ado, let us warmly welcome Dr. Sutthida Chuanwan, Associate Professor at the Institute for Population and Social Research, Mahidol University, Thailand. Good morning, Dr. Sutthida. Thank you very much for being with us today. How are you today?
Yeah, I'm good. Thank you very much. So I have to say selamat pagi, right? Is it mean
Selamat pagi.
selamat pagi?
Oke,
Thank you very much.
selamat pagi, Dr. Sutthida.
Thank you very much. Terima
Okay,
kasih,
I hope
Dr. Sevtiyani.
okay. Oh, terima kasih. Sama-sama, Dokter Sutthida.
And thank
Okay, I
you.
hope everything is well on your side. Are you ready to share your presentation with us, Dr. Sutthida?
Yeah, I will show, but just wanna actually I also have some small activity before starting the section. So yeah, first of all, I would like to thanks Dr. Budiono to very warm welcome. Very nice to meet you. And
Yeah,
I hope that in the future we can meet in advance, maybe
yeah,
in the country.
yeah.
Uh,
You're welcome, and thank you very much for giving the lecture in this, and
and
maybe someday we will meet physically.
And also special thanks to Dr. Farid Nakha to invited me to be here again. As you know that I used to be a guest lecturer, maybe last 4 years, right, Dr. Farid? Right before COVID-19. All right, and
Before
now
COVID.
I'm very happy to be here. I'm really, appreciate it's my pleasure to be with you again. Even though we are in a meeting online, as Dr. Sevtiyani introduced me, I'm expert in population aging, and I also am a demographer. So first of all, really thanks for everyone to be here, and I think today that would be fun and enjoy because as Dr. Budiono said that this topic is really important, especially for a country in Asia like Indonesia and Thailand, which are experiencing rapid demographic change. So over the next maybe around 2 hours, we will look at in the demographic transition and aging situation, including demographic aging and also health challenges for the elderly. And we also learn together from the case studies and the global lesson from some countries where success in healthy aging and successful aging. Okay, along the way, I will ask you to join just small activity to answer some question. So I think that would, help you, or it would encourage you to participate actively. That will make this section more engaging and meaningful. All right. I would like to start with just some question. So please pick your mobile phone and scan QR code. I have some question to let everyone join the activity. So I would like to start with the question. I would like to know that when you think of older person, what one word come to your mind? If anyone cannot, access to QR code, so you can write on the chat box. That's it. That would be fine. So everyone can access, right? Okay, Dr. Farid said that he think about weak. Okay, lonely. Okay, weak and lonely. Let's come together, right? Yeah, sick. All right, weak. Are there any, meaning? That would be the meaning, the first meaning in your mind when I ask you about the older person. Okay, it's too big, very big. Fair. So, are there any meaning that in your mind? Unstable emotion. All right. Anything else? I found that there are only 8 people join this Mentimeter. Anything? All right, I think that is okay. So it shows like there are multiple meaning, but it would be in negative meaning, right? Most of them are negative meaning, as you can see in the screen. Yeah. So yeah, it includes sick, right? Weak, lonely, unstable emotion. Oh, all right. That is the meaning in your mind. So this is exactly what we will explore together today. So I have another one, just not finished yet. Okay, let I move for the next. Okay. So before starting the section, I would like to ask you why we need to study population aging. What do you think about that? Why we need to study it? So the answer is not false and right. So you can please feel free to answer it. All right. Someone answer in the chat box. The answer is to know what are the the aging situation. Right. Anything else? Can you answer in the QR code? Right. You can see in the same screen. I guess that everyone is writing, right? Okay. To determine the characteristics of elderly population. Okay. Anything else? Okay. Because of quality of life, okay, we need to think about the quality of life, right? All right. Because for industrial needs, we get population aging for distinguished from productive age. Okay. To find out the burden of disease. Okay. Yeah, think about healthcare planning. All right. Anything? Are okay. I think it's okay. So you guys still driving or everyone answer, right? Okay. To create prosperity. Okay ค่ะ Okay. Yeah, to promote intergenerational solidarity. Yeah, okay. That's very important. To make proper policy development, yeah, and quality of life. Okay, okay, I will stop for the activity for the first um before we are going to the slide. All right, let me share my slide. So all right, this is the agenda for today. I'm going to talk about the demographic transition and aging situation, including demographic aging, health challenges of the elderly, case studies, and policy implication. And yeah, as I argue about why we need to study population aging. All right, actually, as everyone answered that, yeah, we need to study population aging because population are aging worldwide, right? And as you know that people living longer, as you can see in the trend of life expectancy is increasing, right? For example, in Thailand now, life expectancy for women is around 80 years, and for male is around 72. So we need to study because of not only in the country but also in the global, right? So increasing number of older person lead to change in the age structure. In the next slide, you can see the changing of population pyramid that show the change of age structure. And also, the rising number of older person will impact many areas of society, including in macro and micro level. So today, you can learn about what the effect of the macro and micro level. For example, its impact for demand for health and social care, including social services, health expenditure, budget for the elderly pension, infrastructure, and so on. Yeah, this is the reason why we need to study population aging. And yeah, we also have some reason, including the individual reason, as you may know that we are living in an ageist society. In Thailand, you know that now we are in complete ageist society. It means that the proportion of older person is around 20% of the total population. And I'm sure that in your country, in Indonesia, is the percentage of the older person is increasing rapidly, right? It may be, come into ageist society already, but is it will be complete ageist society soon, very soon. This situation is quite same with some country in the world. All right. So let's begin to the demographic transition and aging situation. I bring the number of total population in the world from the Worldometer. This is one source of data that you can find. This is the real time data, and we found that yeah, I just bought it last night around 8 p.m. So it means that right now the global population has around 8.2 billion people with approximately around 1.14 million, right? That would be being aged 60 years old and over. So this is the number of total population in the world. And you can see that this sort of data show today, you can see today, birth today in the world is around 300,000 and birth death is around one 100,000, right? So this is the kind of really nice sort of data. And also you can see that this is the trend of the population in the world. Yeah, in the past, you can see the peak of the number of population is increasing rapidly, right? But after 2025, you can see that the increase of the number, the population number is maybe slightly stable. It's still increasing, but the peak is not too fast like the previous year, right? So this is like the trend of the number of population in the world. Yeah, this is the top 20 largest country by population. Now I'm still be in the total population in the world, not in the older person, the number of older person in the global population. So you can see that the highest number of total population in the world is in India, right? This is the data in 2024. And the second one will be China, USA, and also Indonesia. Indonesia would be the fourth one. Yeah, but in Thailand would be in the 20. This is the top 20 largest country by population. So in the next 50 years, you can see that India will be the top one of the number of global population. So you can see in your country, that would be in the number 7. The number of population would be around this is yeah 318 million, right? Okay. Yeah, that is the trend the projection of the global population in 2074. Yeah, and this is the graph, line graph that show that you can see that our world is growing older. So you can see in the violet line, this is the number of population age 65 years old and over. You can see that is also increasing rapidly. So contrarily that the number of children who age 0 to 14 is trend to decrease, slightly decrease, right? Yeah, this is, you can see that why we realize that our world is growing older. So you can see from the trend of the number of population by age group in the world. All right, that is the driver is from because of falling fertility and rising life expectancy. Okay. I also make the population pyramid. Yeah, not make, just bring from the uh, world population prospect or from United Nations. The data is from 2024, and you can see that the shape of the pyramid population is it in the world? The world, yeah, its structure is like that. And compare to your country, I think it's quite same, but the shape of the population pyramid during the age of labor force age, right? Is, I think is lower than the world. I mean the shape is quite different. So when you can see the shape of the pyramid population in Thailand, the base of pyramid is quite narrow. Is it because of now the number of birth in Thailand is quite low? So now in Thailand, the birth of the birth is around four 460,000 persons who were born in the last year. So you can see, as you can see in the pyramid population, like the base is quite narrow, and on the top, as mentioned to the elderly people, you can see it's wider than pyramids in your country, right? So it means that as Thailand going to the composite age society, because we have around 20% of population aging. So this is, I try to compare pyramid population from the world, Indonesia and Thailand. Yeah, is it go for quick? Is it the trend of the pyramid population? You can see the shape. This from Thailand. In 1980, the base of pyramid is still wide, right? And after that, after 20 year, next 20 year, and into 2020, the base is quite narrow. And I also project in the next 20 years. So it's very narrow. It's very, narrow. So it means that people already aging. This is the population pyramid in your country. You can see that population pyramid is quite huge. It's very big. So it's because of the number of population in your country is really high, right? So, and the shape of the pyramid population is quite the same because of in your country has still so many students, right? And the number of birth is still high, right? So that's why as when we would like to know the age structure of the population, so we usually use the population pyramid to show the structure of structure of population, that how it changed. So how it changed to the young people to aged people. All right, this is also the same, but yeah, I try to compare between Indonesia and Thailand. You can see that, so is it quite the same trend, like the number of older person in Thailand is quite, higher than in your country. And also, the number of people is 25 to 64 in Thailand is also high, right? So yeah, when compared with the people age 0 to 14, yeah, I think it's going to decrease in Thailand and also in your country, but slightly in decrease. Yeah. So this graph I bring from the UN United Nations World Population Prospect. So you guys can realize that and learn from this graph. All right, so yeah, that's why, as I mentioned about the population pyramid and also the changing of age structure. So is it because of the population aging is a result of the continued decline in fertility and increased life expectancy? So that make the number of older person is increasing. So we call population aging. Generally, the demographic aging of the population is caused by a decrease in the number of births and increase in the life expectancy of population. Or we can say that people can live longer due to the effect of the low fertility and mortality. So that's why we found that the number of the oldest old and centenarian is also increased. So this is the effect from the low fertility and low mortality. All right. So yeah, I'm going to move to specific in the demographic aging. I as you can see that the report from the United Nations, right? It show the number of older person is 65 year old and over, right? But both Thailand and Indonesia, we still use 60 years old and over, right? Am I right? Right? This is the what I call the definition of the older person in my country and your country. So you don't need to answer that. Maybe we know the answer and we can discuss about this. So this slide I make it when I teach the students. So if my class have have several students from many countries. I try to ask them what is the definition of older person in your country, because of actually in Thailand we have the older person X as show that the elderly would be a 60 years old and over, but I'm not sure whether in your country have some X like show that okay the older person would be age 60 years old and over or not. So but some country like Thailand we have the evidence like that. So that's why I always ask students like that, and we try to discuss about this meaning. So yeah, as Indonesia, I have know that your country also use 60 years old and over to be the definition of older person, right? But from the United Nations, it show that it does not define a specific age. Like okay, this age would be older person, but the United Nations always use age 65 years old and over for statistical analysis and indicator related to the elderly. So when you use the data from the United Nations or from the other sort of data, for example, the US statistics or the data from some European, so you can see in the report that most report are used 65 years old and over because of they already said that okay, people can live longer and the life expectancy is okay, increasing. So that's why most developed country many usually extend the cut-off age at 65 years old and over. Right. So this is a definition of the older person. As I mentioned that in Thailand, we have the Older Person Act. It shows that older person is individual whose age is 60 completed year or older and is a Thai citizen. But however, we try to move or change the definition to be 65 years old and over because we thought that they are still young, they still can work, right? They can do something for the society or okay, yeah, they can do everything. So that's why we try to move on or we try to think about how to extend the definition of older person. This is also the classify that age group of older person. Actually, we have three category of aging population that are useful in the discussion of the elderly people. We often describe older person by category, by three category, including young old. Young old is mean age 60 to 69 years or 65 to 74 for developed country. The second one would be middle old, right? That means people who age 70 to 79 years or 75 to 84 years. And also the last group would be the oldest old. That means people who is 90 years old and older or older than 85 years old, right? This is the three age group of older person. So it means that when you are discussing about the older person, please think about the each older person. I mean, each age group have the specific character. So it means that when you go into study some issue, for example, like me, I have a I have a research about the centenarian. So I focus on just only the older person who are in the oldest old until centenarian because of I try to think about the long-term care or the care from the family, right? So that's why I need to focus just in some age group, not for all older person. So please think about that because of like okay, when you think about the how the older person participate in some activity. So you have to think about that. Okay, this activity is fit for the older person who are just in the young old. So that's why you have to think about just young old, right? Because if you also study with the oldest old, so it means that people in the oldest old, they most of them cannot do some activity. They just would like to just stay at home. So the answer of your study would be not important because of you cannot select uh, the right age group to study that topic. So that is the meaning that I would like to let you know and think about how to select the right age group of older person when you have some issue to think about. All right. Okay, and not only for the age group of the older person, you have uh, if you know that we have the level of the aging society, right? Um, as I mentioned about, okay, now Thailand, we are in complete aged society because I know that the number of not the number, the proportion of older person in Thailand is around 20% of the total population. So I can mention that Thailand is already complete aged society. Like in your country, you may know that okay, the proportion of older person in your country is around 15, right? So you can say that all right, Indonesia is going to is already aged society, but is and also going to be complete aged society in the next maybe 5 years or 10 years, something like that. So this is just like the how to classify the level of uh, becoming aging society. Yeah. For as you know that Japan is the country has the highest proportion of older person in Thailand in the world. So you can see that the proportion of older person is, more than now. If I remember that Japan has around 35% of the total population. So it means that Japan is already super aged society. So that's why percentage of older person is the one of the measurement of population aging, right? So you can use this slide to think about how to, measure which countries already become aged society or complete aged society or super aged society. And also, you may know that we have median age, right? This also the one measurement of population aging. So it shows that age that divides the population into two parts of the equal size. So it means that if there are so many people with age above the median as they are with age below the median. So yeah, actually we have the calculation like we have the formula to calculate the median age and you can see the level of median age if the median age of that country more than 40 years, so it means that that country is already aging. But if less than, if I remember that it's around 20 to 30, so it means that that country is still be young or going to be um, labor force people, right? Like the middle old, right? All right. Let's see the number of the global population is 60 years old and over. In 2025, this is in the world we have 1,272 million person, or is around 15% of the total population in the world. And yeah, I try to calculate the percentage of the elderly people classified by regions and some ASEAN country. Yeah, you may see that um, the most the developed region has the highest percentage of uh, elderly people. It's around 27 percent of the total population in the world. And when classified by the region, you can see that Europe has the highest percentage of older people in the world. Yeah, followed by in the Northern America. And when focusing on the aging of population among ASEAN member countries, yeah, overall we have around 13% of the total population in ASEAN. But you can see that the highest percentage of older person in the world would be Thailand. Yeah, this is the data from United Nations. It shows 23%. Yeah, followed by the Vietnam. And in your country is around 12% of the total population in your country. Okay, this is the percentage of the older person in, yeah, for each country. Okay, and I try to calculate top and bottom by rate of aging or the proportion of older person in that country. So for the top 10 country, it show that yeah, Monaco has the highest percentage of the older person. And yeah, you can see that Japan, yeah, would be 76% of the total population. Yeah, this is in Asia that, yeah, this is one of top 10 country. And also Hong Kong, right? Yeah, that this country would be, already aging. And for the bottom 10 country, you can see that most of them are in Africa, right? Yeah, including, yeah, Zambia, right? Rwanda, Uganda, Chad, something like that. So, yeah, I try to make it, yeah, top and bottom for the rate of population aging. All right, I would like to ask you that what is your expected lifespan? Can you type in the chat box? I would like to know yet that how long you would be, still alive, and what is your expected lifespan? Have you think about that before? Okay. Okay, Dr. Farid, 70, right? With healthy and wealthy. Okay. Anyone? Anyone? Do you have any idea or think about that before? You have never think about that? Okay, 75 and still beautiful. Wow. And useful. Okay, good idea. Any answers? Don't think too much, just, think the answer as, in your mind. When you think about that, just, by quick, like, okay, I would be 70 or 80, right? So yeah, from the two answer, it show that not only for, longer life, but also we need to think about healthy, active really, right? Or wealthy, and with not poor health, right? Just like a good health, with good health, right? Any answer? No? Okay. Yeah, so okay, I would like to show that this is the longest lifespan in the world. You may know that she is the longest documented lifespan in the world. So her name is Madame Jane Calment. The Guinness World Record recorded that she is the longest documented. You can see that we should put documented, right? Because of you can see that there are so many people who claimed that to be, the longest people in the world. So these people, it show that she already has the documented to show that she has the age 120 years. And also at present, this is the present, the longest living person in the world is Madame Caterham. If I remember that she is from England. Mm. Now she is 116 years old. So I try to think about that people has the ceiling of lifespan or not. I used to read some article. Maybe it's published in 1970 or 80. I couldn't remember, but something at that year. So it showed that we had the ceiling of lifespan is around 110. This is the ceiling, right? So it means that people can live until 110. But that paper published has been published in more than 50 years. But now I'm pretty sure that the ceiling of the lifespan of people would be around 116 years. That I follow the record from the Guinness Book. It shows that most of them would be 116 or 117. After that, they already passed away. And for the next people who still alive would be, the longest living person. So that's why I'm pretty sure that it would be the ceiling of the lifespan in the of people, right? So yeah, this is the that's why it's related to the population aging because as you know that now people can live longer. And yeah, let's see that how does population aging affect a country. So as I mentioned earlier that it affect both macro level and micro level, right? So yeah, in the macro level, it effect in the chain, decrease and increase for it's changing from the age structure. As you can see, the pyramid population is changed, right? And also it changed because of the number of older person exceed the number of children. In terms of decrease, you can see that the number, most country has the the number of working age is going to decrease. And in terms of the increase, you can see that the number of older person is increasing rapidly, and also the demand and cost of the maybe in terms of health services in some budget that would be increased if the number of older person is increasing, and also infrastructure. So we have to increase some budget and also think about how to create it, make it fit to the number of older person in a country, right? So in this slide, you can see that an increased population of older person affect to increase on the dependent people. As you answer me in the icebreaker activity, so most what it show that we need to face with the dependent people. Yeah, they are weak, right? They are fail, they are bed ridden, they are, they need to stay in the house lonely, something like that. So we have to face with the dependent people. And also, the increased population of older person affect to increase in the demand for health and social care, and also health expenditure and budget for the elderly pension, and also infrastructure, as I discussed earlier. That would be in terms of increase. Not only for the negative impact, but also you can see positive impacts as well. So it means that increasing number of older person provide the companies with new market opportunity. This is just the example that you can see. You may see the specialist products for the elderly. For example, now you may see that we have some product that suitable for older first person. For example, we have like what's that? Something like for example the manual exercise, something like that. I could not remember. Yeah. So it's special for the older person, right? And also we have growing job opportunity in care home and shelter accommodation. Yeah. For example, in Thailand, as you know that the number of children is decreasing. So in the past, we have so many number of the nursing school. But now, when the number of children is decreasing, so some community change from the nursery to be the elderly center. Yeah, that is the opportunity to change some setting to be, to be fit to the number of older person in that community. And also the growing construction opportunity, building retirement home and flat. And utilizing the knowledge and experience of the older workforce, that would be positive impact. Yeah. In the micro level, so in terms of change, need and increase, you can see the effect of older person that would be in terms of the family structure. You can see that we will be the uh, the field of the household member as this is the effect of low fertility as well. So that's why the number of family would be decreased, and also the living arrangement. Um, Not only in Thailand but also around the world, we show that the number of older person who living alone or living with spouse only is also increasing because of the effect of the low fertility. So that's why we need to think about how to care them, how do they live in their house by active, and we need to take care of them, and also the care, so they also need care, including physical care, emotional, financial, and social care, and also the cost for older person, uh, specific about the health expenditure, right? And also the physical health that would be happen with the older person around about NCD and Alzheimer or disabled people, and also technology for older person. All right, this is the effect of the population aging in micro level. For the next. All right, so that's why I mentioned about macro and micro level. You can see that is it linked together. For example, when the government cannot support enough pension on healthcare, families must carry this responsibility, right? And when the country faces labor shortages, the older person may get more work opportunity. And when we see more healthcare spending at the national level, it reflects the daily reality of individual living longer with health problems. So that's why macro and micro level that's linked together. All right, so this is it about the population aging. Are there any questions before I'm going to the health challenges of the elderly? Or you guys would like to discuss about these issues? All right. If no question or discussion, I'm going to the next section that would be about health challenges of the elderly. Okay. In some paper, it shows that there are 4 key dimensions of older person's well-being health. So it includes health. Health is mean not only for physical health, but also we need to think about mental health as well. And also productive work, economic security, and also social engagement. That would be 4 key dimensions of older person well-being health. Yeah, this is the data, not data. This is I summarize from the paper. It shows that health of older person would be, would be important when we think about the older person. So, as you can see that we are facing significant challenges regarding the health of our aging population. So the data show that why life expectancy is increasing, as you know from the data that most I think every country has the increasing of the life expectancy, right? But too many of those extended years are not healthy one, right? As you can see the answer that we are expected to live longer, but we need we need the healthy and wealthy, right? And we need to have a good health. So that is the like an ideal that if we need to stay longer, but we need to stay longer with a good health. So that is the our expectation. But if you can see in the data, it shows that even though we are living longer, but we are still be in the poor health. That's it shown from the data. And also, the burden from the NCD is remain alarmingly high, exceeding, for example, around 80% of the overall disease burden, especially in the heart disease or diabetes, and a sharp rise in the dementia. This includes high rate of the disease and depression among elderly women. And yeah, also it tells us that we urgently need to think universal health coverage and long-term care. That should be very important. And you may know about the life cost approach, right? So it means that we need to think about not only when you are in the old person, but also we need to think about good health during you are in the young age, in the labor force age, and also in the older age. So that's we call life cost approach, right? And yeah, this is the solution that we need to propose how to have a good health during, in every step of your life. So that's why we need to promote lifelong investment in health and immediately integrated cost-effective mental health care into our primary systems. So let's ensure our extra year are healthy years. So that is the this paper mentioned about health of older person. So let's think about that. Yeah, it also have key highlight. This paper is about aging well in Asia. So you can look at the challenges that the older person face. So even though extreme poverty has decreased, right? But many older persons are still poor. And as people age, physical and mental health problems become more serious. But many live with long-term illness, feel lonely, or do not have enough access to health services and long-term care. Yeah, we still found uh, older person face this situation. And in many countries, most older persons still work in informal jobs. For example, about 94% of the working age are in the informal employment. So this means that they often do not have pension or good job protection. So we need to think about the services for them. And gender is also important, right? Women, as you know that women usually live longer than men, but they often spend more year in poor health. So because of this issue, many older adults must continue working as long as they have around. So this show us why we need to think about life cycle approach in policy. As I mentioned earlier that the life course approach is very important. We need to make sure that people are supported not only in old age, but also in throughout their life. That is the highlight of the uh, paper that show that why we need to think about the older person. All right, not only for the highlight related to health in population aging, but also is increasing about problem, uh, obstacles and challenges in promoting people health. So as you know that when people getting old, they also have the problem about health, right? Including high consumption. They like to eat the sweet food, fatty and salty food, and also the insufficient exercise, right? And also high level of smoking and alcohol consumption. This is the main problem. The solution that we can do that we need to think about proactive campaign through diverse media, right? We need to advertise to let them know that what is the important, what is the consumption that is very risky products, and we need to organizing accessible physical activity in community. This is the solution. And the next challenges would be the service system and infrastructure. We can see that it show that most policy would be in the treatment rather than prevention, right? So it's because of when the government focusing on the treatment rather than prevention, that would make the high cost burden. So we need to, think about how to promote prevention rather than treatment, right? That is the one thing that I want to focus. And also, it's about unequal distribution. So, yeah, it found that health resources are difficult to access in remote area. I'm pretty sure that not only for in my country, but also in your country. Also, we need to think about how to aggregate or have the connection, to access, to let most older person to access healthcare services, and also this continuous policy, right? So the solution would be we need to shift budget toward prevention and promotion, right? As I mentioned that, let's think about the promotion and prevention, and also distribute personnel to local area and strengthen policy continually. Yeah, this is the challenges one. And also think about the environment and society. It would be include air pollution, right? As you may find some places that we have the unhealthy environment that affected their health, and also insufficient green space. And also, we need to face with aging society that would affect to increasing demand for long-term healthcare and non-communicable disease. So we need to develop healthy cities, increase public space for physical activity, and create specific health plan for the elderly. You may know the concept of the age-friendly city, right? So it means that we need to think about how to make the environment to be friendly with the older person. So that is the one concept that related to the active aging and healthy aging. All right, another challenge would be health communication and literacy. You can see that we have the fake health news, right? So that is the information that overload and distortion. And also for the vulnerable group, they have limited to access for the information. And also, the values emphasizing treatment over prevention. So for this challenge, the solution would be develop accessible and uh, credible health media and promote health literacy. You may know the word of health literacy, right? Actually, not only health literacy, but also technology literacy as well, because they need to, to know how to realize and think about which one are the real, which one are the fake news. Yeah, to communicate to the older person. I would like to give you know the situation in Thailand. We have the elderly school and elderly craft. So in the activity, we also have the like giving the information about the health, how to use the social media to search health information, how to use line to communicate with their friends, something like that. So this is the one activity in the elderly craft or in the elderly school. All right, in terms of policy and system management, we need to think about the budget. Yeah, health promotion shows slow result, right? And also is leading to the receive less budget. So this is the challenge. And also to integrate it with the corporations, some government among the multiple sector. So that's very important as well. And also the impact of the technology and social change. So in the solution, we need to think about long-term health investment and flexible policy to communicate new behavior and cross-section collaboration. So this is the solution. As I mentioned that we have the 5 system that we need to integrate together. That would be health promotion requirement. All dimension would be integrated together. Especially, we need to think about the long-term investment for better quality of life and reducing disease burden. Not only for Thai people, but also for people in your country as well. This is quite it may be summarized for this for challenges of health. So you can see that we also have increasing demand on healthcare services, right? And so that's why we have to health promotion among older person. So in the supply side, you can see that we need to think about the demand, including health personnel, including the specialists, nurse, caregiver, and community worker. And also we need to think about increasing expenditure on healthcare and also housing for the elderly care. That would be the challenges of health for the older person. All right. So I'm not sure, do we have a break or not? Dr. Sevtiyani, do we have a break or no need? Cannot hear. Should I, break for the coffee break or just go on? I cannot hear you. Sorry.
I'm sorry, Miss Sutthida, I have some problem.
And then no problem. So should we have a break or just do continue? All right. So should I? Okay. I'm go ahead. All right. So yeah, I also bring some case study and a global lesson. So it's including in Japan, as you know that this country has the highest proportion of the older person, right? So yeah, Japan, this country has the comprehensive system and strong communities. So you can see that. Oh, sorry. Oh, sorry. Yeah, Japan has the comprehensive system and strong community, right? And as you can see that the highest proportion of older person in the world, now they are super aged society. And the highlight of the Japan is the government has long prepared for the demographic shift through a community-based integrated care system. I have learned that they are the first pioneer to think about the long-term care. So it's combining healthcare, nursing, disease prevention, housing, and daily living support. So we can, follow the Japan system, right? And also, Japan has the health services. So it's increasing age-friendly housing design and technology, as you can see the robot, right, from Japan, and also caregiver support systems. That would be the highlight for the Japan. This the next one would be Singapore. So you may know that Singapore used to be the country which has the highest proportion of older person in ASEAN, right? But now Thailand. So Singapore has a modern city, right? As you know that there are so many buildings. So they can, manage and support the older person very well, right? So they, as you see on the slide, it shows that Singapore has launched the active plan for successful aging. Yeah, this is the highlight of the Singapore. They propose. I used to watch the series. It's called Live to 100, and Singapore would be the new blue zone. Have you ever heard that? Not only in Japan, but also Singapore would be the new blue zone. So it shows that Singapore government has very good management to take care of their older person. If I remember that they have the policy to think about taking care of older person. So they propose the student to take care of their parent. The student who are coming back to um, take care of their parent, they would get some benefit from the government. So yeah, the country, this country is very, strong policy. So we can you can learn about um, policy from this country later on. And also in Singapore, they have innovation, so many innovation, including the technology, right? For example, home sensors or telecare, and also housing development tailored to aging needs, and also community activities. Yeah, if we still have time, I may, turn on the video for you guys. And also in terms of the, as you know that there are so many buildings, but they are very, strong in terms of the age-friendly city, right? Like, in Thailand, it's very difficult to collect the data in the Bangkok because of, they living alone. They like, this is the character of older person in the urban area. They try just, keep themselves in their house. They didn't want to, go out to do any activity. That is the character of older person in the urban area. But in Singapore, it's different. They, have some activity, and most older person enjoy to, go out to do some activity together. And the government try to make the concrete area to be the green area. So that would, make Singapore to becoming an age-friendly city. And this is Thailand. So we can say that, yeah, we have a good beginning, but more development needs that. Yeah, we have the concept of the aging in place. So it means that we propose the older person living in their community or their house until they die. But we need to have some support to make them living in their house or community um, by aging by what's that? Like to make their community to friendly living in their, until they die. So yeah, we have not yet have national level aging in place policy, but we, try to measure a friendly city assessment and promoting of community volunteer. So that is the Thailand lesson. And yeah, I'm not sure if it's updated or not. So for Indonesia, yeah, the government has already taken important step, right? So Indonesia has the national plan of for action on aging, right? And there are some program we call universal health insurance to coverage and service quality for elderly care, right? And also, Indonesia has the community program. So you may help me to give some information later on. So that's it. I found some information via internet. All right, this is the three pillar of aging in place is including home, community, and caregivers. So that is the concept that we try to promote. All right. Yeah, in terms of the policy implication on population aging, as I mentioned earlier, that three concepts would be, link each other. It's including active aging, healthy aging, and age-friendly city. That would be the core main issue that most country would be rich. So it means that how the country would be, promote or support older person to be, active aging, to healthy aging and age-friendly city. That would be the key main issue. Yeah, and as you may know that during 2022, 21 until 2030, the United States has programmed that during this year, we propose it to be the decade of healthy aging. So it's this is the include not only for doing just for your individual, but we need to think, to feel, and to act toward age and aging. We need to think about the community, person center, and also long-term care. That would be the decade of healthy aging. So this is the 4 key area. Yeah. So not only for this concept, but we usually put the SDG concept into support population aging in a country. So it is just the example that we can propose the policy implications following the achievement of the SDG goal, right? For example, in the SDG number 5 and 8, that promoting gender and equality and also improve labor force participation. And we usually use the SDG number 3. It's about the well-being, right? So when you focus on the population aging, you may think about the investing in education and health and well-being for all, and also lifelong learning, and also SDG 3 and 8 is include the promoting retirement saving. Yeah. Yeah, there are so many policy implications based on SDG that you can find, right? Let me move to this is the common policy measure that promote 3 main issues, is including active aging, lifelong learning, and retirement saving. I think this three message is very important for every country when we are thinking about how to promote or support population aging. So we need to think about 3 main issues. The graph that you see, this is I summarize from the paper. The paper is named Aging Well in Asia. So you can see that this is the region, right? In terms of our country, right? Southeast Asia, you can see in the blue circle, in the blue dot. So this paper summarize for us that what are the policy we would focus on. For example, for the blue dot. So we need to promote active and healthy aging, including promote private saving, also prevent abuse of older person, and address discrimination against other person at work, and so on. So it would be the common policy that we need to propose, right? You can see this graph later on. This is like a summary for aging in Asia. So the government can do more to empower the citizen to plan and prepare for old age. So as I mentioned earlier, it should be including lifelong and life cycle approach, right? Investment in health, education, and financial security. So that fit to the active aging concept, and also expand pension and healthcare coverage. And also we need to promote social engagement and intergenerational program. I remember that one answer from the one word that I asked you earlier. And also encourage private sector role in a friendly environment. So that would be like the overall summarize um, from the aging in Asia. And also, the policy should focus on support healthy aging. That would be a strategy for support healthy aging. And also supporting healthy living from young age. Yeah, as I mentioned earlier, that we need to think about the life cost approach, not only support healthy people in the older age, but also we need to think about the younger age as well. And also support older people participation in community, right? And also um, need for population level policy, right? Throughout the life course that I mentioned before. Yeah, that would be the benefits and challenges for the country that going to give the give the focus on the population aging. And this is very important that we discuss that the challenges for the cultural benefit is very also important. Yeah, need think about the loneliness. As remember that we focus on not only for physical health, but also we need to think about mental health as well. So loneliness is very important. And if you can see the data, we found that most of them are loneliness when um, you know when they need to live alone, even though they used to live with their family or with their spouse, but one day their spouse passed away, so they need to change their arrangement, like live to change their life to living alone. So that's why it's really important, right? And also, we need to think about the community and intergenerational relationship to promote well-being, right? Yeah, and also intergenerational housing trend. Yeah, this is the cultural benefit and challenges. In terms of the family care and social engagement, the challenges that we discussed earlier, that the trend of the increasing number of the elderly living alone, that is very important. And also it's about unmet need for long-term care, especially for the women and the poor, right? And also long-term care system should be support aging in place. So the policy we need to focus. It shows that the government should provide the respite care, right? Think about that when the older person go to the hospital and they cannot stay in the hospital. Finally, they need to stay in their house in the community. So the community need to think about caring them, even though they are living alone or they are living with their family. They need to think about how to take care of them. Because when I go to in the field work and I found that the older person who had the dementia, right? They are going to be, the dementia. They need to stay at home, so they can not do anything. luckily someone has the family to take care of them, but someone they living alone. So I think the responsibility would be for the community to take care of them, or the local government need to think about that, how to take care of them, um, how to, find a volunteer
Ya enaknya kamu terus ngomong
to take care of them. So that's why it's very important as well to think about the respect, respect care. All right. And also it's about the integrated care system and also social engagement in the community, right? Okay. It's going to, it's almost the last slide for today. So this is quite a summarize, but as you know that I already mentioned already. So the opportunity and strategy would be not only in the individual level, but also in the organizational and private sector level, and also government and policy level. So we need to think about these three level. Okay. This is like what's that life cost approach that the policy need to improve the quality of life, not only in the early life, but also we need to think about midlife and later life as well. Okay. So this is the last slide that I try to conclude that. So let's remember that the core message of today is the aging is both challenges, right, and opportunity, and opportunity not a burden. So we need to change our mind, like okay, population aging is not a burden, but it is an opportunity. So if we prepare earlier, we can face with the population aging. So another one is the right achieving this divided share responsibility. So as I mentioned earlier that finally the older person need to stay at home, right? So we need to think about who would be the responsibility. If the older person living alone or living with just only spouse, so the first was that organization would be that I think that would be the local government. So they because the local government is very close up to the older person in the community. So that's why I think that would be their responsibility, and also family, including family as well. So as the quote said that age is just a number. Quality of life depend on today preparation. So that's I mentioned that we need to prepare not only in the young age, not only in the old age, but also we need to prepare when you are in the young age. All right, I think that is yeah. Okay, this is the last slide, and I try to ask you again. So let's I move to the that Mentimeter to ask you guys. Right. Just a moment. Um, Actually, I prepared so many questions, but I'm not sure that whether may boring. All right, this is the last question that I would like to ask you. If you had to summarize today's lecture in one word, what would it be? So this is like just like a to evaluate me. All right. Okay. Oh, sorry, I forgot to make the okay. Uh, okay. Beneficial. All right. Anything else? Very delightful. Thank you. Anything else? Any answer? Mhm. Don't think too much. Just one word. All right. Delightful. Insightful. Enjoyable. Thank you. Inspiring. Great. Open new idea. Awesome. Okay, fun. All right, anything else? Informative. All right. Okay. Thank you. All right. I think everyone answered. Thank you very much for your active participation. All right. Okay. I hope that today's section has expanded your understanding of the elderly health from a demographic, medical, and cultural perspective, right? Thank you.โอเคค่ะ Wow. Thank you very much, everyone, to yeah, for your active participation. I hope that you guys learned a lot from the elderly health, right? And I encourage you all to continue reflecting critically on how to build a society for all age, right? So yeah, โอเคค่ะ So it has been an honor to spend this time with you all, and thank you once again. Yeah, I think everyone still, think about it. All right. All right, I think I will stop now. if anyone has any questions or would like to discuss with me, so please.
Okay. Thank you very much, Dr. Sutthida, for such an insightful and comprehensive presentation. The topic you shared is highly relevant, especially for countries like Indonesia, and I believe all of us here have gained valuable perspective from your talk. Now, we will begin the discussion session. Dear
Okay.
participant, you are welcome to raise your hand and ask directly, or you might type your question in the chat box and I will read it out for you. Okay? To all participants, you can chat your question in chat box. Okay, this is question from Miftahur Rahimah, Dr. Sutthida. The presentation highlight the rising burden of non-communicable disease among older persons. From an epidemiological perspective, which risk factors should be prioritized for prevention to reduce years life in poor health? Okay, Dr. Sutthida, please feel free to respond.
Like I mentioned about the let's show the slide. As Thailand, we try to reduce the NCD, right? And yeah, let's move to some slide.
Zoom keluar lagi, Cel.
Yeah, sorry. So do you hear the slide? Right? Oh, do you see the slide?
Coba, yes, gitu. Yes.
Yeah. So yeah, this is that I mentioned that this is the main problem of older person, right? Yeah, they has the um not good consumption. So we need to uh, think about how to change their behavior, right? So because it make the older person faced with some disease, especially in the NCD. So I think the prioritize of the older person, they need to reduce or change their behavior. For example, they need to think about the food with the sweetest, and fatty or salty food. They need to escape from this kind of food. So I think when they change their behavior, not only for eating but also they need to do exercise. Yeah, because the data found that they have the sedentary lifestyle. So they need to not only for change the food, the consumption behavior, but also they need to think about the to do the exercise. Yeah, I think that would be the prioritize for the older person. Okay. Yeah, the next question is about with the rising cost of elderly healthcare, how does the government balance sustainability of health financial with the ability to provide services? And what are the key challenges in integrated medical care with social and medical services and how also okay. For the first question, how does the government balance, right, sustainability of health financial with rental provider? It's very difficult to answer this question because as I mentioned that now the problem is most the government would like to they try to focus on treatment system rather than the prevention system. So as I mentioned about the solution that the government should think about the prevention and promotion. That would be, we need to, the government should think about the prevention and promotion. So if, the budget focusing on the activity that would support in the prevention and prevention that would help people, and they can balance between prevention and promotion with the treatment system. And for the second question that would ask about what are the key challenges in integrating medical care and social and long-term care services for the elderly and how is policy addressed? Yeah, so I have a research about the dementia. So in terms of the social care, I went to the fieldwork to talk with the local government, and the big problem is we don't have the linkage between medical care and social care. So it means that we need to think about the how to, you know, how to, what's that, integrate between two dimension to work two dimension from the medical and social. So let's think about we need to think about the non-seamless between two dimension, social care and medical care. So the solution is we need to work together between the social care and medical care. That means that the medical care, including the hospital or the local hospital, need to work with the local government that they are decided some activity to support the social care. So if both sides work together or they do some activity together, I think that would help to close the seamless, right? Yeah. And the next question, how can healthcare system balance the increasing demand of elderly care with limited financial and human resources without promising quality? Balance increasing demand. Yeah, how balance, right? So I think because of, so let's move to this. As I show this slide, right? So this is the demand, right? And yeah, this is the demand for the older person. The demand not only for older person, but also in the, general item, including health personnel and expenditure on healthcare, and this is for in the developed side, housing for elderly care. Yeah, I think that would the answer, I think we should prioritize which one is very important, the most important. For example, you can see that the some area they can have just only one nurse or one doctor, right? Even though there in that area there are so many older person has some disease, but they still have only one, doctor. So it's been we need to, as I go to the field work, I try to do the process and survey what is the need for older person and what is the demand for older person, and we try to fit with the thing that the local government can support. So if we can fit which one is the best part of both sides, so they can manage which one is the first priority, right? So I think we can we can ask the we can research in the need and the demand for the older person to think about which one is the first priority. Yeah. Uh-huh. Mhm. I think it's very difficult to think about the, uh, financial, right, in the government because they have the limitation for the financial related to health issue because they have to share not only for the health part but also in the economic part and also, in the transportation part, something like that. So, yeah, that's why. The important thing is we need to have the data to show that, okay, now the older person has the problem. So the health personnel is are needed in the community, something like that. So that's why the data is very important. We need to do the survey or we need to do the research, to give them the information. Okay. The next question. Any question?
Okay, any other question? Oh,
Found it? Please.
okay.
I cannot hear you. Okay. Can you write? When I say something, not the question, or want to say something?
Okay, now I can speak.
Okay.
Okay, long time no see.
Yeah, glad to see you.
Yeah, it is not too serious question. Before it is very serious question. Do you have any, for example, any video or any photo that explain about the activity, elderly activity in Thailand?
Photo what? Say again?
Photo the activity of elderly.
Uh,
Elderly activity. Maybe you have video or photo. Yeah,
okay.
you can share with us.
Okay, right. So actually, I just have the like the video clip that
Yeah,
I work with the local government, and this research is about how to empower the local government personnel um to create or to know the what is that population data.
yeah,
So open the slide website for the
yeah.
ITSR นะคะ just a moment. I try to find it. Just wait. Just a moment นะคะ so Just a moment.
Yeah.
1, 2, 5. Okay. Sorry. Just a moment. Research. Research. Sorry. Sorry. I can find.
It's
Just
okay. It's okay.
I'm fine. I'm sorting the clip video. Just a moment. Facebook. Okay, I found it. All right. So should I share? Okay. Share sound. Okay. Okay, can you see the screen?
ประชากรสูงวัยที่เพิ่มขึ้นสร้างความท้าทายให้กับบุคลากรที่ปฏิบัติงานในองค์กรปกครองส่วนท้องถิ่นและพีระมิดประชากรจะช่วยแก้ไขปัญหาเหล่านี้ได้อย่างไร
โครงการเสริมสร้างศักยภาพบุคลากรขององค์กรปกครองส่วนท้องถิ่นด้วยการใช้ข้อมูลประชากรเพื่อขับเคลื่อนการเป็นสังคมสูงวัยอย่างมีพลังโครงการของเรานะคะเรามีวัตถุประสงค์หลักเพื่อเสริมสร้างสมรรถนะของบุคลากรในองค์กรปกครองส่วนท้องถิ่นให้สามารถใช้ประโยชน์จากข้อมูลประชากรในพื้นที่ของเขาเองนะคะเพื่อนำไปใช้ในการวางแผนประชากรทุกกลุ่มวัยเลยนะคะนอกจากนี้แล้วเราได้มีการพัฒนาโปรแกรมพีระมิดประชากรเพื่อเป็นเครื่องมือสำคัญนะคะในการนำเสนอโครงสร้างอายุและเพศของประชากรในพื้นที่เพื่อทางองค์กรปกครองส่วนท้องถิ่นจะได้นำข้อมูลประชากรนะคะนำไปใช้ในการวางแผนเพื่อกำหนดเป็นนโยบายต่างๆให้กับพื้นที่ต่อไปค่ะสำหรับกิจกรรมหลักของโครงการของเรานะคะก็คือการจัดอบรมเพื่อพัฒนาสมรรถนะของบุคลากรในองค์กรปกครองส่วนท้องถิ่นเราได้มีการส่งจดหมายเชิญชวนองค์กรปกครองส่วนท้องถิ่นที่อยู่ในจังหวัดนครปฐมนะคะว่ามีความสนใจในการเข้ามาร่วมอบรมโปรแกรมพีระมิดประชากรของเราหรือไม่ทั้งนี้มีองค์กรปกครองส่วนท้องถิ่นด้วยกันจำนวน20แห่งที่ให้ความสนใจนะคะซึ่งประกอบด้วยองค์กรปกครองส่วนท้องถิ่นที่อยู่ในอำเภอเมืองนครปฐมอำเภอพุทธมณฑลอำเภอสามพรานและอำเภอนครชัยศรีนะคะและเป้าหมายหลักในการอบรมในครั้งนี้นะคะเรามีความตั้งใจที่จะหากลไกหรือวิธีการที่จะช่วยให้ทุกองค์กรปกครองส่วนท้องถิ่นในประเทศไทยได้เข้าถึงข้อมูลประชากรของกระทรวงมหาดไทยแล้วนำมาใช้ในงานขององค์กรปกครองส่วนท้องถิ่นของท่านได้อย่างมีประสิทธิภาพกลไกหรือวิธีการที่พวกเราคิดได้ในขณะนี้คือการสร้างโปรแกรมคอมพิวเตอร์ที่จะแปลงข้อมูลจำนวนและโครงสร้างเพศและอายุของประชากรอย่างละเอียดมากที่เผยแพร่ในเว็บไซต์ของกรมการปกครองให้เป็นข้อมูลที่อ่านและเข้าใจได้ง่ายเพื่อที่แต่ละองค์กรปกครองส่วนท้องถิ่นไม่ว่าจะเป็นคณะผู้บริหารหรือประชาชนจะได้รู้จักประชากรทั้งขนาดและลักษณะโครงสร้างเพศอายุของประชากรในพื้นที่ของตนเราได้มีการจัดทำบันทึกข้อตกลงความร่วมมือในการเสริมสร้างสมรรถนะบุคลากร
Ajan, and maybe you can explain a little bit what is inside this meeting. It is very interesting, yeah.
สร้างความร่วมมือในการเสริมสร้างสมรรถนะของบุคลากรในองค์กรปกครองส่วนท้องถิ่นให้สามารถใช้ข้อมูลที่
see the slide
แผนตามคุณภาพชีวิตของประชากร
Yeah,
ในระ
yeah.
ดับ
Maybe you can explain in English a little bit while the
okay
video is running.
oh you cannot hear right okay
Yeah.
okay just yeah actually I have some photo right I think show photo that would be better right
Yeah. Yeah.
โอเคค่ะ so can you see that can you see the
Yes. Yes.
photo yeah
Yes.
I go to in the field right and yeah to visit the older person
Mm.
that this is the activity that we go to the elderly club
Elderly.
ค่ะ elderly club ค่ะ yeah then this is one activity from one district that they try to make the activity to promote the physical health so they have the jogging or running activity yeah this is the yeah I gave some food to the elderly and visit some elderly yeah อาจารย์ประโมทค่ะ
Oh, Ajahn Pramod, still there.
yeah
Oh,
he's อาจารย์ประโมท yeah อาจารย์ประโมท he's my will be my advisor and a consultant yeah
consultant.
this is I took a photo with older person in the elderly school yeah
Oh,
they try to think about how to bring the what's that the cultural activity like they like to do the Thai dance right
okay.
yeah they do the activity
Traditional Thai dance.
right Thai dance but they mix with the how to do exercise with the Thai
Ah,
dance
I see.
ค่ะ
Yeah, yeah.
Yeah, this is a like a bit okay, that's all. All right, thank
It is
you.
very, very interesting.
Yeah,
Yeah, very interesting.
thank you. So, when we are, doing the research, we try to go to the community and, talk with the leadership of that district. And, they try to think about what do they need. I mean, the older person in that district.
Yes.
And, yeah, they, I I think about the thing that I mean the activity that we did for the other person need to be from their need, not only from our thought.
Our perspective, yeah.
So that's why we try to talk to everyone, every other person to think about what do they want, what do they need, and how to create the activity that fit for them. So that's why we need to go to the elderly club or go to the elderly school to discuss with them. And after that, we select only one activity to make them to support them. Yeah, for example, the last time we did we we try to find a moderator to talking about how to give them the technology literacy because they they familiar with their mobile phone, right? And everyone have the Line application, right?
Yeah.
But they could not design or send some flower or send
I see.
tune for their, you know, their friend or their children. So we find someone to teach them, right?
Quite
Okay.
interesting. Yeah.
Yeah.
Digital literacy. So you
Right.
motivate them to use the The line. Okay.
Yeah,
Interesting.
they familiar with line. So I think this is very easiest than teaching something because most of them
Okay.
can lie.
Okay.
Yeah. All right.
Okay, maybe I plan to invite you to Indonesia actually.
Yeah.
Because Ajan Yotin,
Welcome.
Kun Isara, they already visit Indonesia 3 or 4 times. They come here.
Okay.
Maybe
Yeah.
another time I will invite you to Indonesia,
Thank
and then
you.
we can collaborate it, research, mostly focusing in elderly.
Thank you. It's my pleasure.
Okay. Okay, Bu Imaniar, time is yours.
Thank you. Yeah.
Okay, Dr. Sutthida, I apologize for the trouble here. The weather is cloudy, so the internet connection is unstable.
Yeah,
But
I think so.
yeah, but
Maybe it's
I
up
should
to
mention,
finish.
yeah, but I should mention that I am not the host now, so I also cannot unmute myself.
Don't worry. So, if anyone has a question, so I think I dropped my email address into the last slide. So, yeah, if you guys have some question or would like to discuss with me, so send me message directly.
Okay, but Dr. Sutthida, we still have another question. Would you kindly respond it?
Huh?
We have another question from Dion and from wait, Sakina.
Okay. The question is, how does the government ensure the sustainability of elderly medical care in the face of demographic change and future challenges, right? Um, so the government ensure I think the challenges is not only to provide adequate healthcare for today elderly population, but also to anticipate future demographic shift and adapt system, right? So how does the government? So I'm thinking about answer. How does the government ensure the change? How does it ensure the support of the medical care in the face of the demographic? How should I answer? Medical care in the face. As I for the quick answer. So I think if you ask how, right? So I think as I mentioned earlier that the data is very important. If we have some data that show that okay the medical care is very important and it should be faced with the demographic change and future challenges that would as if we have the some evidence to confirm that this is very important and it should be the priority to to support or think about that. So that would uh, help the government have some data to to create or to promote some policy, right? I think as I try to uh, give some give give an importance to the data. As my project, I try to think about why the demographic data is very important. So if you are, a leader in, for example, if you are a leader in the district and you did not have any data to know that how many people in, okay, how many children, how many older person in the community. So how would you know? How would you solve the problem? So I think the first thing you need to um, give the information, give to the data to the government to know that what is the problem, uh, what is the thing that the government need to do in the first thing. Yeah, I think that would be challenges. Okay. โอเคค่ะ All right. And I would like to explain in the video, right? In the video, you can see that, as I mentioned that I have the project that to empower the local government personnel to know the importance of demographic data. So I try to make the the training for them, how to create the population pyramid, how to know what is the importance of the demographic data. So actually in Thailand, we have the demographic data where the Ministry of Interior. So most of them did not know that we already have the number of population by age group. So every time when they would like to know the number of people in their community, they need to, send a report or, beg for someone to get the data. But actually they can access easier, but they did not know yet. So that's why this activity we try to make them have the knowledge about how to give the demographic data. And after that, they can create their own population pyramid from their community. So that's why I would like to say that the data is very important. If you have the data to be backup data, right, to be the backup, so that would help not only for you but also the government can see the problem, can see the how to solve some issue in the society. All right. Thank you.
Okay, thank you, Dr. Sutthida. Thank you very much for the thoughtful and the clear and inspiring responses. Okay, okay, no question. Okay. Okay, Dr. Sutthida, your insight have inspired us deeply. We truly appreciate your willingness to be part of our academic life here at Universitas Diponegoro. Before we conclude, may I kindly invite you to share a short closing statement with us?
Okay. Yeah, I would like to say thank you very much. Terima kasih everyone to join this section and really active participation. So I hope that the lesson today is, useful for everyone to inspire and think about how to prepare, right? Before we are going to be old age, right? And I hope that we can work together or we can meet in advance. Hopefully, maybe, and Dr. Farid said that maybe next year Okay, I will be there and to meet everyone. Thank you very much, Terima kasih.
Okay. Okay, thank you, Dr. Sutthida. May I say a few words in Thai? Swadikap, kapun kap, Dr. Sutthida. Okay,
I would like
am
to
I
take
right?
with everyone. Yeah, it's good. Yeah. So
Okay.
could we take a photo together? I mean, with
Okay.
everyone.
Okay. To all the participants, can you open the camera? We take picture together. Okay. 1, 2, 3. Once again, 1, 2, 3. Okay, thank you. Once again, thank you, Dr. Sutthida, for your valuable insight and contribution on behalf of the Faculty of Public Health Universitas Diponegoro. I sincerely appreciate your time and expertise. We hope this won't be the last time we meet. May this lecture mark the beginning of a future collaboration, joint research, and strong academic ties between Mahidol University and Universitas Diponegoro. Okay, I would also like to thank all participants for your active engagement and attention throughout this session. Take care, everyone. Have a beautiful day ahead. See you again very soon, Dr. Sutthida. Wassalamualaikum warahmatullahi
Terima
wabarakatuh.
kasih.ค่ะ